Our next speaker is Dr. Kim Liu. Kim spent her childhood in Western Sydney with Buddhist parents, where she learnt to tread lightly on this earth. Now, in addition to working with patients, she actively advocates for action on climate change and biodiversity loss. Through her work in Doctors for the Environment, the Council of Australian Medical Association and the Royal Australian Council of GPs. Kim is directing her efforts towards a cohesive narrative which inspires people to reimagine the future, and today she'll be focusing on the dangers of heat waves and how trees and urban greening can help save lives and improve mental health. Let's welcome Kim.
I acknowledge the traditional custodians of this land who have looked after our air, water, soils and ecosystems for millennia. And I want to thank Citygreens for inviting me today with all the experts who are working on the solutions. And I'm truly grateful to be here. So I'm on the council of the Royal Australian College of General Practitioners for New South Wales and ACT, and the Australian Medical Association and Doctors for the Environment, as their spokesperson for biodiversity loss and for climate action. We recently, Doctors for the Environment and World Wildlife Fund collaborated on a report on trees and health. And what they found was only 25% of people understood the health benefits of trees. So we've got a lot of educating to do in the community. So a scoping study was done last year which looked at trees. So what can they do to actually reduce harm? Can reduce air pollution, reduce UV radiation and reduce heat. But trees have restorative capacities as well. They can improve mental health, reduce stress and overall improve health outcomes. And building capacity. Trees can help improve birth outcomes and are there for active living, will be encouraging active living. So, what is the burden of health in Western Sydney? So my numbers are from the health economists from Ernst & Young, commissioned by West Primary Health Network. So 1 in 11 people live in Western Sydney, and 85% of adults in Western Sydney have one chronic health problem. And 80,000 people who live in economic poverty in Western Sydney have 2 or more health problems. And they found that 60% of these people, this very vulnerable community, presented to hospital, and 25% of them were admitted. And normally when I show this number, even to my audience of my peers, they're horrified at the number of people with a chronic disease. So why do we have so many people with chronic disease? Okay, so when I started medicine in Sydney University, I think in 1985, we learnt about the biology of disease. So this is determined on your age, your race, your gender, and your genetics. So if you have a family history where you've got hypertension, cardiovascular disease, high cholesterol, diabetes, have asthma, eczema, you have anxiety or depression, you're more at risk of that. And what do we use as treatments? Yes, we use medications, pharmacotherapy, but we also use lifestyle modification. So my mother's a social worker, and this is part of the reason that I really advocate for the social determinants of health. Because you can't improve someone's lifestyle if they live in poverty, if they have unstable housing, if they're choosing between their medications and food and the rent. And it's really government policy that really impacts on the social determinants of health. And I have got patients who live in intergenerational poverty, intergenerational unemployment. And it is very hard to improve the way you eat, time your food, sleep, when there are so many stresses on your day-to-day health. And then I'm just going to talk about something that's actually not there, the commercial determinants of health. So the commercial determinants of health are highly processed foods, sugary drinks, alcohol industry, the tobacco industry and the fossil fuel industry. All these industries have a lot of money and powerful tools to advocate that impact on our health as well. Then you look at the environmental determinants of health. So, the environmental determinants of health are clean air, clean water, healthy soils, a stable climate, and a healthy ecosystem. And we can see that over the years we've just had a myriad of problems in every single sector. So it's really important that we understand that heat is the silent killer. People are still not cognizant of how dangerous heat can be. There was a study done 2 years ago by Thomas Longdon in the ANU where he looked at heat waves and the number of deaths. And more people have died from heat waves in Australia than all other natural disasters combined. And it is the silent killer. I just say it's not visible, a cyclone. And consequently, over the years, there's been less funding for heat adaptation. And so I'm so grateful there's so many experts here that are working in this space. So, who is vulnerable from heat? If it gets to over 45 degrees, all of us are vulnerable. So there are a lot of researchers in this area, and one of the leading researchers is Professor Ollie Jay with his Heat Incubation Hub, looking at the physiology of heat on the human body. And he is one of the leading researchers in this area, looking at the impacts of physiology and ways to cool down for patients living in poverty. So what do we know? We know that women who are pregnant are really vulnerable during heat waves. Women who are pregnant, in the first trimester, your blood pressure goes lower, your blood volume expands by a third. So you're at risk of a heat wave if you become dehydrated. We've told pregnant patients for years in the first trimester, try not to get hot, don't go into a spa or a sauna, because there is data that there's increased heart abnormalities if you get hot for a prolonged period of time during the first trimester. And you look at babies and children have a larger area to absorb heat than adults. They can't do the behavioural adaptations for heat. They can't get out of a car seat by themselves. They can't move out of the way of a hot area by themselves necessarily. They always need adults around. And if you look at school children, what we know about school children is that in order for them to focus and concentrate, they need the classroom around about 22 to 24 degrees. And I know my kids are now 23 and 18, and when they were in primary school, they really had hot classrooms. And if it is actually inequity, if parts of Sydney have air-conditioned classrooms, it's getting better at primary school, but there's still a lot of high schools that don't have air conditioning. And then you have the group of people who are vulnerable. And you can see from the data from Western Sydney, there's a huge number of people vulnerable. So if you have a pre-existing disease like renal failure, respiratory failure, heart failure, diabetes, and you are more at risk during a heat wave. And if you look at heart failure, how do we cool down? We cool down by moving blood to our skin. We sweat, and our capillaries dilate on our skin. So we lose water, but that actually reduces the amount of blood going to the heart as well. So if your heart is vulnerable, you're more likely to die during a heat wave. And the reason I put in over 65 there's good data collected from the Melbourne and the Adelaide heat wave, and they found that most of the people who died were over the age of 65. And what is a heat wave? It's 3 days of the highest minimum or maximum temperature for that region. So if you have 3 days where you get really hot nights and hot days, then your body doesn't have the ability to cool down, and people with any sort of underlying disease are more likely to die. And they found that in the Melbourne heat waves, it's 28 degrees. People died at 28 degrees at night. If you're physically disabled, you mightn't be able to actually move out of the way when it's hot. You mightn't be easily able to access fluids when it's hot. And mental illness. So with mental illness, there are people who are on medications that alter their ability to thermoregulate. A lot of the medications that are taken for anxiety, depression, are more likely to alter your ability to sweat and thermoregulate. Lithium, which is taken for bipolar disorder, if you're dehydrated, it can reach toxic levels. And even if you look at medications, other medications that are deactivated by heat. I had one patient who was epileptic, and he left his medication called Keppra on his dashboard, but heat actually deactivates the medication. So he's putting it in his car just so he wouldn't forget to take the medication. So there is still a lot of education that needs to be done amongst patients regarding heat waves as well. So there's new data that has been published, and it's now on the New South Wales Department of Health website on climate change and heat. And New South Wales has data on heat waves and humidity, because humidity compounds the impacts of heat. And they've found that children during heat waves and humidity are more likely to self-harm. We know that domestic violence increases during heat waves. You can just look at the police data. And there's increased risk of suicides during heat waves. A study that was done in Mexico and the US found that with 1 degree higher heat, there was an increase of 0.9% for US and 2.1% of suicides at a 1 degree rise in temperature, of average temperature. So with climate change, in terms of the rising temperatures, there's a risk of increased suicides. And I'll put isolation is a significant risk factor for health during heat waves. And there's more people living on their own who are elderly now. So when it's hot, there's no one there to remind you to drink. So people are more likely to die from heart attacks if they live alone. And poverty. So with poverty, really, most people live in thermally inefficient houses within Western Sydney. People used to die from cold and heat. I remember one of my patients with heart failure was so cold in the house, she just slept in under blankets all day and she didn't really move. And that really diminished her heart capacity because she couldn't afford to actually turn on the heater. So in order for people to have a safe house, it needs to be thermally efficient. And this is why I'm in the advocacy in the housing space. And poverty is increasing in our community. 1 in 6 kids lives in poverty. How can a country like Australia have 1 in 6 kids living in poverty? And outdoor workers. So during heat waves, most of the people who actually end up being in hospital are the outdoor workers. We still don't actually have good heat plans for a lot of workspaces for workers who work outside. I'm just going to talk a little bit about air pollution as well, because it actually flies below the radar, and this is from a headline 2 weeks ago. Because trees help reduce harm from air pollution as well. So how does air pollution actually kill 11,000 people a year? So air pollution is like a big soup of different sized particles. The aerosol pollutants, which is nitrous dioxide, sulfur dioxide, and ozone. And this shows how with the particulate pollutants, the size of it. So with particulate pollutants, that we measure them in 2.5 microns and 5 microns. And there's years of data regarding the smallest particle, 2.5 microns, of causing harm in all areas. There was a very elegant study done in the UK a few years ago where they actually had someone breathe in gold particles of PM 2.5, and they found that they could actually trace in all systems in the body. That's why, besides actually increasing the risk of heart attacks and strokes, it also impacts on babies who are growing, impacts on the growth of babies. It increases the risk of type 2 diabetes, And we know that trees can help with air pollution. That NO3 should be NO2. So there is good studies now from Barcelona about nitrous dioxide and mental health and cognitive function in children. So the Barcelona study looked at 7-year-olds in multiple schools living near high traffic areas and low traffic areas. And they found that the children who are living near, going to school in high traffic areas actually had an impairment of their working memory. So if trees can actually help with filtering part of this, it's a bonus. And this is a slide from my friend Anna-Greta Hunter, who's a cardiologist. So when we're stressed, we actually activate the flight and fright system, the sympathetic nervous system. But when we relax, it's activating the parasympathetic nervous system. And being trees has been shown to actually help with hypertension and your pulse rate. And there's a question of whether it can, there's some very soft evidence that it can reduce the risk of sudden cardiac death. And I've just put this as birth outcomes, because if you think about it, both heat and air pollution impact on birth outcomes. So if we have these two things that can impact our babies when they're in utero, they're impacted by climate change and air pollution from the point of conception. And that is a horrifying thought. So if we can actually improve urban greening, act on climate change, reduce bioavailability loss, we can actually improve birth outcomes. So mental health, and I think the numbers are actually higher than this slide, 13% of adults in Australia, which means it's the 4th highest cost to our health budget. I'm going to talk about Thomas Burt Astor's study on this, and I should have put his name up there. So he's a professor at Wollongong University, and he did a study where he looked at 43,000 people in Wollongong, Newcastle and Sydney, and looked at their attention and their state of depression and their mental health with looking at tree canopy cover, and he's found that there was a reduction by 31% in terms of depression and improvement of the working memory. Sorry, I should say attention and general cognition, not working memory, sorry. There are studies to show that increasing canopy cover also reduces crime rate. So this is a study from Boston. Prescriptions for nature. So we know the benefits of trees for mental health, for overall improvement in all disorders actually. And this is why there's a lot of the newer hospitals being built have windows that look on to courtyards that have trees, because we know it improves outcome for patients, reduces their need for pain medications. So I actually do give nature prescriptions at work. It's actually on a normal script paper as well. My patients are now really aware, because I've been advocating in this area for so long, that nature is such an important tool to actually improve mental health. So I send people to my local environment centre to look for bushwalks to go on. And we know that there have been studies to show that it's like normal, if someone goes in grassland and it's green, it doesn't make any difference. But if people actually go into a forest, this is why there's forest bathing in Japan that has been culturally linked to their communities for a long time. There's 2 forests they use for forest bathing in Victoria. We're waiting for one in New South Wales. And this is my garden. So this is my food forest in my backyard, and I've got a forest in my front yard that's a native garden forest, because every time I was angry or anxious, I'd stick a tree in the ground. So it's, so I think I've put in 30 trees into my suburban block. In my front garden, the person who worked in the council across the road walked across and said, "Do you know what you're doing?" I actually also, because I practice permaculture, I also put leaf mulch, 18 cubic metres of leaf mulch on my front yard to improve the soil quality because it's hydrophobic. So now this is my group, Doctors for the Environment. So we are really active in all advocacy spaces, and we come from all disciplines. From left, gastroenterologist, neonatologist, psychiatrist, psychiatric registrar, GP, paediatric psychiatrist, neurologist, cardiologist, anaesthetist. So this is our team, our core team in New South Wales. So we now have about 3,000 members who are active in the space of political advocacy, education, and in also ethical investments. So I see banks regarding ethical investments, and so with my team in Doctors for the Environment. So it requires a health voice. We were started in 2003 because our three founders, realised at that point in time that our health is integral to a healthy environment. Thank you.